Welcome back in. We are talking about mental health. We know how important it is, but oftentimes it's not really talked about, especially in women and minority populations. But Center of Hope Family Services aims to get that conversation going sooner. Today we have Dr. Tracee Perryman with us, the CEO and co-founder of COHFS, to talk a little bit more about your nonprofit, but also a book that recently came out. Hi, Tracee. Thanks so much.
Hello, and thank you for having me here. It's definitely a privilege.
We are so glad to have you. First, we'll get to your book, but we want to talk a little bit about your nonprofit. So I guess tell me about your organization and how'd you get it started?
So of course, Center of Hope has been around for 26 years. And we started with tutoring and support services to families in the back of a church fellowship hall.
Oh, wow.
And so here we are 26 years later with 3 divisions to the organization and serving children around after school programming, adults who have children who are court involved, adults who are looking for employment, or adults who have issues with child welfare. And now we are growing deeper into mental health services, intervention and awareness as well.
And that's what we want to talk about a little bit today. You guys are working with the state to focus on mental health, specifically in women and minorities now, right?
Yes, so this is actually our 3rd project with the Ohio Department of Mental Health and Addiction Services around reducing the stigma to increase access to mental health services for minorities.
Wow. How important is, being able to have these services and resources for people, women and minorities, to be able to tackle mental health and talk about it because it is a stigma?
Absolutely. So minorities underutilize mental health services. And so in keeping with the mission and vision of Center of Hope, it is very important to reduce any barriers to actualizing the life you want. And so mental health symptoms can definitely be a barrier to thriving, adjusting at work, adjusting at school, doing the things that you need to do, adjusting within your family. And so what we focused on in this particular project was increasing the awareness of practitioners. I didn't feel that it's enough to increase awareness for the public to use the services, but how do we help practitioners create services that minorities want to use? How do they better engage the minority population? And then how do we provide services that make sense and align with the experiences of ethnic and cultural minorities?
And that makes a lot of sense because sometimes you want someone, if you're talking about something maybe you're not comfortable talking about, you want someone that you're willing and open to, that can relate and connect with you, and it helps that back and forth, right?
Absolutely. Feeling that you're heard, feeling that you're understood, but then as we move into treatment, what we want to make sure of is that we're distinguishing our personal preferences from choices that actually align with mental and emotional wellness. And sometimes that's where we lose minority populations because we start framing the intervention through what we're used to instead of seeing the world through their eyes and helping them walk that path through their own life experiences and help them co-design the light at the end of the tunnel and what that looks like.
So let's talk a little bit about your book. It's called Elevating Women Leaders. Yes. Where did, all of this stem from?
Absolutely. So as we started digging deeper into the issues of mental wellness and ethnic and cultural minorities, we also understood that women are a protected class. And women have a lot of barriers to thriving in their professional lives. And what we also found was that working women report more mental health symptoms than non-working women and working men. So this was definitely a population that needed attention. And from a personal standpoint, I always promised myself that I would provide the wisdom, I would provide the information that I often did not receive while I was on the journey of growing into leadership myself.
So this really dives into what barriers women face and how to overcome it then, correct?
How to overcome them and how to develop our own coping strategies. So it supports mental wellness through prevention, but then also aftercare. So if we need intervention, how do we keep ourselves in balance when we are on our own and when that treatment experience is over?
Well, Tracee, thanks so much for joining us today talking about mental health, especially in women and minorities.
Thank you so much.
If you all are interested in this book, Dr. Tracee said we can get it on Amazon. All right, we will have more after the break.